All right, moving on to the next bone of the upper extremity, we're going to take a look at the scapula next. So with me currently right now, I am holding a right scapula, and I'm kind of holding it how it would anatomically sit. It's going to get a little bit tricky from this view, but what we're basically looking at is trying to arrange this, again, anatomically. So we're going to look at some landmarks that are superior, inferior, medial, lateral, anterior, posterior, just like we did with the clavicle. Couple landmarks that are going to be really easy to pick out. One is this nice huge long landmark right here on this bone known as the spine of the scapula, and that is a very posterior bony landmark, so that's pretty easy. The acromion process, which I'm currently holding in my hand right now, just kind of moving that back and forth. This is a lateral and superior landmark. If we turn this around to the other side, this is the coracoid process that sticks out both anterior and again out laterally. And obviously when we get to it, this is the glenoid fossa or cavity. So all three of these kind of bumpy bits to the bone are sticking out towards the humerus or laterally. So that is one clear indicator. So the spine being posterior and all the bumps out to the lateral aspect. Turning this bone over, we're looking at an anterior view now. So we have a nice, smooth, large subspace here. That was known as subscapular fossa, versus again on the posterior, see the spine, and then you have two fossas above and below. We'll get into those, but infra and supra spinous fossa. The medial border running all the way along the edge here. So again, this whole vertebral or medial border, and then again, our bumps sticking out to the lateral side. Last thing, really, really easy. You have a superior, and then towards the bottom, we have an inferior angle of the scapula. So when you're holding this, I highly suggest looking at the spine, putting this facing towards you with the bumps facing out, so you'll know that this is right. We're going to start going through the bony landmarks on the posterior aspect of the bone. So there's a lot to describe when it comes to a scapula. So one of the first things that I'd like to do is just describe all of the borders before we get into the independent landmarks. So the first border that I'm going to go through is again starting all the way from the top of this bone, running all the way to the bottom of it. This whole edge is known as your medial border, though some textbooks will call it the vertebral border just because the spine is actually here. So this is facing the vertebrae. So you have a nice long medial border, and it has a couple angulations into it. A lot of kind of texts will talk about this being a nice smooth edge, and then it almost angles superior and lateral. So for some references, this landmark right here is known as your medial angle, though it's not in every text reference. Towards the top of this bone, you can see a nice triangular shape here. This is your superior angle. So this is a bony landmark we'll be palpating eventually. So again, nice and easy to find on plastic, a little bit harder to find on the human body. And towards the bottom, we're going to have what is known as the inferior angle of the scapula. So we have a superior, a medial, and an inferior angle. This being the medial border, and then opposite that, running along the outside of the bone, this being our lateral border. So running all the way up and then stopping at the glenoid cavity or fossa. So when you're placing this bone, again anatomically, that superior and inferior angle are medial and lateral border, and a bit of a harder border to define itself, but some will reference this upper part as the superior border. So it might have the superior surface or the superior border of the scapula, naming a couple landmarks that are up along the top here. Okay, so now that we've looked at angles and borders, we're going to start to look at some of the bony landmarks. The first and simplest one we've already kind of discussed is this whole landmark in here is known as the spine of the scapula. However, the spine of the scapula can actually be broken down into a few more parts. At the beginning, or what is closer to the medial side, you can see that the scapula starts to widen a little bit. And so some references call this the root or the beginning of it. So this is known as the root of the spine of the scapula, right in this location here. So we'll talk about some muscle attachment in rhomboid minor attaching right to this root of the spine of the scapula on that medial border. So just a slight variance is this is known as the medial angle, which kind of changes in its direction, but this thickening and widening and almost flat spot you can see right here is the root. As we start heading along the spine of the scapula, it actually thickens and widens out a little bit, and it creates a little bit of an impression below. This is known as the tubercle of the spine of the scapula. So right in here, this is one of the insertion points for your lower trapezius muscle, which kind of pulls and creates a little bit of a bump in there, as well as deltoid is attaching right in this upper superior part of it. So we have root, we have tubercle, and then a continuation of the spine until it turns right in this location, and then all of this is known as the acromion process. So one more kind of landmark to go along with that. We have spine, tubercle, and then acromion, and you can almost start the acromion once you go past this angulation here. So the spine continues, and then it rounds a corner, and then starts heading very anterior. So this edge right here is known as the acromial angle. So again, this whole piece right here is the acromion process. Basically able to hold on to that, which we have quite a bit of muscle attachment all the way along the side here. And I'm going to see how easy this is to do, but I'm going to bring in the previously discussed clavicle. And so our clavicle is going to be making an articulation point over here, known as the Acromioclavicular Joint. So right where this acromion and clavicle meet, we have a joint in there. So we also have a bit of a flat spot or a facet to the front for your clavicle in that location. Okay, let's take the clavicle out of the way. So we've looked at the spine now, and now we're going to discuss landmarks above and below it. So because this is the spine, this whole impression, or a bit of a narrow, let's not call it narrow, let's I guess call it shallow fossa that's described in this area here, is called the inferior spinous fossa. So inferior spinous fossa. And this is the origin of a muscle known as infraspinatus. So this whole broad surface is covered with muscle tissue. And then if we go above it, the opposite of infra, we have supra. So this is known as the supraspinous fossa. Quite a bit deeper fossa. This is going to be the main belly of supraspinatus sitting inside of this location in here. So both of these fossas are filled with muscle tissue that we will be palpating in other videos. All right, one more landmark. It's a bit of a sneaky one to try and get to. This is a few different references call this different names, but one of the ones generically, it's just a notch. So you have a notch between the supra and infra fossa, so right in this area. But because this is also called the spine, sometimes it's called subspinous notch. And that's basically because it's below the spine of the scapula, and it is a notch shape here. So we've talked about above and below all along the spine. So let's just discuss a couple landmarks towards the lateral aspect next. As I turn this bone, we've run our finger all along the lateral border, but if you look really carefully, it starts to get quite rough up towards the superior part of that. So again, our lateral border, very lateral and superior along that lateral border. This is known as the infraglenoid tubercle. So glenoid being in reference to this bony landmark here, known as the glenoid cavity or fossa, and since this is below it, it is the infraglenoid tubercle. So this is going to be one of the muscle attachments for your triceps muscle. Similarly, if you have the glenoid fossa here, there's actually a little tiny bump or rough patch just to the top of that, and this is the supraglenoid tubercle, and that is going to be one of the attachments for your biceps brachii. Okay, lots of landmarks for us to discuss. I'm going to turn this and start looking towards the top just to bring up in one more here. We've had the supraspinous fossa. However, you can see this nice cutout right in here, this being the superior border, the superior part of the scapula, and this is known as the suprascapular notch. So this is going to be covered, which you can look in some of your resources. There's a little tiny band of tissue or ligament crossing that, and that leaves a nice opening for nerves and arteries, which you can look up in a different reference. I'm going to turn this bone over towards the anterior view, getting close to finishing with all the landmarks. And so you have a very obvious one sticking out from the front of this bone. It sticks out quite anterior and heading lateral. This is known as your coracoid process. So the coracoid process is a major muscle attachment as well as ligamentous tissue. So we have ligaments going above up to the clavicle, but you have multiple muscles coming down off of this bony landmark. So this is a palpable item that we will show you, as well as we'll be finding both coraco and biceps and pectoralis minor all attaching to this coracoid process. And I believe that is all the bony landmarks that we're going to be discussing on this bone today.